Thank you so much, Gerard, for inviting me to speak on this panel. My name is Justine Friedman, and I work as a clinical dietitian and a mindset mentor. The needs of a woman going through pregnancy are increased compared to normal daily living. And one of the concerns that many women have, pregnant women have, is the changes to appetite that can occur, which may inhibit them from fully being able to eat according to how they would like to during pregnancy. Added to this, some great anxieties that may be present due to needs perhaps for amniocentesis or changes in their body that they are not used to, the unexpected outcome of which they are not sure of, are all factors that play a role with the choices in nutrition that women can have. One of the common complaints that I see with clients coming to me is the changes in taste and the aversions to certain foods, which can also inhibit them from eating well. And one of the main areas that they would like to be taking care of themselves and their future baby during pregnancy is in order to be able to nourish themselves correctly. Many women find that during pregnancy, their own needs almost come second to what they would like for their baby. The actual nutrition needs for women that are important to pay attention to during these months of pregnancy, and sometimes even before in preparation for pregnancy, are in order to be able to ensure that their folic acid is high enough, iron levels increase during pregnancy, the need for omega-3 fatty acids increases, as well as protein, specifically protein from the second trimester and onwards. And these are all nutrients that can be obtained through foods, but oftentimes they are supplemented as well. What I see as common anxieties during pregnancy are often due to morning sickness, due to the rise in progesterone levels, and this can hijack their eating and make them feel unsure of what to eat, because so often the nausea causes a problem with food choices, and the traditional foods that women then start going for are very dry carbohydrate foods, crackers, toast, cheeses, which they can stomach but may not always be the most nutritious for their bodies. From an anxiety point of view with pregnancy, the changes that can happen can also be physical, like constipation being a concern that can add to worry and frustration. Sometimes normal fiber intake doesn't do enough to assist for them to really feel that they can get their stomach working okay, and they need to take supplements for that. Oftentimes reflux or heartburn can also be very uncomfortable, specifically towards the end of the pregnancy. And one of the areas that I like to focus on with my clients who are going through pregnancy is to ensure that in order to reduce the anxiety that they are experiencing, that they are making the most nourishing choices possible within the scope of what they can handle. So what we focus on is foods that are the most nourishing for the gut, because we know that the gut microbiome is essential in assisting with health in the body in general, and it also affects mood. So when we have a gut microbiome that is experiencing dysbiosis, which means that it is not in balance, the good bacteria that we want to proliferate are in smaller quantities, smaller amounts, as opposed to the bacteria that are not as beneficial. What happens is there's a reduction in serotonin levels, and this then affects levels of their mood, which then predisposes them to anxiety and depression. So foods that boost a healthy and robust gut is essential in general for health, but specifically in pregnancy. So some women are not able to get sufficient probiotics from their diet, and in those situations I encourage a probiotic supplement, and this is something that they would need to also just run past their doctor and make sure that they're comfortable with it as well. In general, probiotics are safe, although we don't always know from all the different ranges out there which are the most complete. So in general, I would suggest something with lactobacillus as well as bifidobacteria. Those are two of the main ones that are very good for promoting good gut health. And then to encourage good fiber intake in order to be able to feed the good bacteria in the gut. Other areas that could be a concern with pregnancy are the risk of gestational diabetes, and clients who come to me who have destabilized blood sugar levels during pregnancy, then we work on how best to eat in order to reduce the glucose spikes after meals. So this is another area of anxiety that can occur, as well as a client that I'm working with currently who has ulcerative colitis, and it's caused changes to her inflammatory cycle. So also focusing on gut health is a priority for me when I'm dealing specifically with clients who have also coexisting conditions or are at risk for other conditions during pregnancy. So the main focus is ensuring that they have enough water in their diet, 2 liters on average, in order to ensure that they are not dehydrated. Good sources of probiotics, whether it's in supplement form or through foods as well, which are generally from fermented foods, as well as foods that will then nourish the gut and enhance the proliferation of the good bacteria so that we can increase serotonin levels, which then has a positive effect on mood, on levels of anxiety and depression. Obviously, there's the whole mindset aspect to that, which I also do discuss with my clients. And other nutrition advice that I give is to ensure that they are following as closely as possible a Mediterranean diet approach, which is high in omega-3s, which has good sources of protein, whole grains, and the main focus of the omega-3s in this diet is the things like olive oil, olives, walnuts, chia seeds, flax seeds, some of the other nuts and seeds as well, good sources of fish like salmon, the fattier fish. In general, we also encourage good sources of foods like eggs, as well as calcium sources in dairy products in order to ensure that they are getting enough iron, enough calcium in their diet as well. There's a lot of other supplements that doctors would look at, but in general, I would say that a woman who feels confident in the food choices that they're making during pregnancy will also allow them to have a lower level of anxiety going through the whole process. Confidence about knowing what to choose, about how to manage symptoms if they have morning sickness, if they are experiencing heartburn, if they are experiencing any gastric disturbances like constipation as well, so that they really feel as supported as possible during this process in order to ensure that their anxiety levels, their stress, their worry is as low as possible. Thank you so much. If there are any questions, I'm happy to respond to those. And thank you for inviting me to speak.